What is fentanyl? Fentanyl is a synthetic opioid first synthesized in 1960 by Paul Janssen, a Belgian pharmacist and founder of Janssen Pharmaceutica. It is 50 to 100 times more potent than morphine and is primarily used for managing severe pain, such as advanced cancer pain. However, its potency also makes it a popular drug for illegal use, leading to widespread abuse and countless deaths. The illegal production and distribution of fentanyl is a growing issue in many countries, with the drug being manufactured in clandestine labs and sold on the streets. This has led to a rise in overdose deaths, as users often don't know the strength of their drug. In addition, fentanyl is often mixed with other drugs, such as heroin, making it even more dangerous. The widespread abuse of fentanyl has also led to increased efforts to combat the opioid epidemic, with law enforcement agencies cracking down on illegal production and distribution. Despite these efforts, the problem persists, highlighting the need for increased education and awareness about the dangers of fentanyl and other opioids. Is fentanyl addictive? Fentanyl, a powerful opioid, is known to be highly addictive due to its potent effects on the brain's reward system. When taken, it induces a state of intense euphoria and relaxation, which users often seek to replicate, leading to a cycle of addiction. As a result, users may take the drug longer and require higher doses to achieve the same effect, further increasing the risk of overdose and death. In addition, the risk of overdose is significantly higher when fentanyl is taken with other drugs or alcohol, which is why it is often considered a leading cause of opioid-related deaths. The dangers of fentanyl are compounded by the fact that it is often mixed with other drugs, making it even more difficult for users to know what they are taking. Therefore, it is crucial to raise awareness of the risks associated with fentanyl use and to provide access to treatment and support for those struggling with addiction. Fentanyl and other drugs. Fentanyl, a synthetic opioid, is commonly used in medical settings for pain relief. However, it has also become a major concern in the illicit drug market due to its cheap cost and high potency. In fact, it is often mixed with other drugs like heroin, cocaine, methamphetamine, and MDMA to boost their effects. This is particularly dangerous as users may be unaware that fentanyl is present in their drugs, which can lead to unintentional overdoses. Moreover, the potency of fentanyl varies greatly, and even a tiny amount can be lethal. In addition, the effects of fentanyl can be long-lasting, causing users to remain unconscious for hours. This can delay medical treatment and increase the risk of serious harm or death. Therefore, it is crucial to raise awareness about the dangers of fentanyl use and to take steps to prevent its misuse. Why is fentanyl so deadly? Fentanyl, a synthetic opioid pain reliever, is considered to be one of the deadliest drugs in the current drug epidemic in the United States. Its potency is such that even a small dose of just 2 milligrams can be lethal. Even more concerning is the fact that it is often mixed with other drugs, such as heroin or cocaine, and sold on the street. Because of this, users may not be aware that they are taking fentanyl or may not fully understand the risk involved. The drug is known to depress the central nervous system, which in turn slows down breathing. This can lead to respiratory arrest, which is a condition where breathing stops altogether and can ultimately lead to death. In addition to its potency, fentanyl is also highly addictive, making it extremely difficult for users to quit even if they are aware of the dangers. Therefore, it is essential that people are educated about the dangers of fentanyl and the risks associated with opioid abuse in order to prevent further tragedies caused by this deadly drug. Where is fentanyl manufactured? Most illicit fentanyl, a powerful synthetic opioid, is manufactured in China, a country with a vast chemical industry. The drug is produced in clandestine labs by chemists who alter the structure of the drug to create analogs that evade existing drug laws. These analogs are then sold to drug traffickers who bring them to other countries, including the United States, where they are responsible for a significant portion of overdose deaths. The Chinese government has struggled to regulate these labs due to the country's vast chemical industry, making monitoring every facility difficult. Furthermore, the labs often operate with little oversight, making it easy for chemists to produce and distribute the drugs without fear of being caught. This lack of regulation not only contributes to the opioid epidemic in other countries but also poses significant risks to the health and safety of those working in the labs and living nearby. One way to reformat this section to state that the Chinese government has not made significant progress in hampering fentanyl production could be: despite attempts by the Chinese government to regulate and monitor the country's chemical industry, there has been little progress in curtailing fentanyl production. The vastness and complexity of the industry make it challenging to monitor every facility, and illicit labs often operate with little oversight. This lack of regulation not only contributes to the opioid epidemic globally but also poses significant risks to the health and safety of those working in the labs and living nearby. Efforts to combat the production and distribution of illicit fentanyl have been ongoing, with some progress being made in recent years. However, the problem persists and is compounded by the constantly evolving nature of the drug market. Continued efforts and international cooperation are necessary to address this pressing issue. Why isn't it being stopped at the manufacturing point? Efforts to halt the production of fentanyl in China have been facing numerous challenges. Despite the Chinese government's attempts to regulate and monitor the country's chemical industry, the sheer size and complexity of the industry has made it difficult to put an end to the production of fentanyl. Furthermore, corruption and lack of enforcement have contributed to the problem. These factors have made it difficult to hold manufacturers accountable for their actions. Although the Chinese government has banned several fentanyl analogs, new ones are constantly being created, further complicating the issue at hand. As a result, the fight against fentanyl production in China remains an uphill battle that requires a multifaceted approach and the cooperation of all parties to succeed. How does fentanyl reach America? Fentanyl, a synthetic opioid pain reliever, has become a significant public health concern in recent years. The drug is often shipped from China to Mexico or Canada, where it is then smuggled into the United States. This route of trafficking has made it extremely difficult for law enforcement agencies to track and intercept the drug before it reaches the streets. Moreover, fentanyl is also directly mailed to the U.S. in small packages, which makes it even more challenging to detect. The drug is often sold online on the dark web, which further complicates efforts to track and stop its distribution. The illegal manufacturing of fentanyl has also become a growing problem. The drug is relatively cheap to produce, which has made it appealing to drug traffickers looking to make a quick profit. As a result, there has been a significant increase in the number of clandestine labs producing fentanyl, particularly in China and Mexico. Fentanyl is highly addictive and up to 100 times more potent than morphine. It can cause severe respiratory depression, leading to death, even at low doses. The drug is often mixed with other substances, such as heroin or cocaine, which increases the risk of overdose and death. Given the serious health risks associated with fentanyl, it is crucial to continue efforts to prevent its trafficking and distribution. This requires a multifaceted approach that includes increased border security, greater international cooperation, and expanded access to addiction treatment programs. The escalating impact of fentanyl on communities and families. The escalating crisis of fentanyl addiction and overdose in the United States is not only significant but also devastating. According to the U.S. Centers for Disease Control and Prevention, CDC, the rate of deaths involving fentanyl, the most frequently implicated substance, has skyrocketed from 6 per 100,000 people to 22 per 100,000 in just 5 years. The rate of overdose deaths involving synthetic opioids, including fentanyl and its analogs, increased by over 56% from 2019 to 2020. In 2020 alone, more than 56,000 people died from overdoses involving synthetic opioids, a figure that is over 18 times the number recorded in 2013. Fentanyl and other synthetic opioids have become the most common drugs involved in overdose deaths. Even in small doses, fentanyl can be lethal, with over 150 people dying every day from overdoses related to synthetic opioids like fentanyl. The CDC released new data in 2022 indicating a significant increase in the percentage of overdose deaths from fentanyl combined with xylazine, a veterinary drug used as a sedative and pain reliever in animals. Between January 2019 and June 2022, the monthly percentage of such